Are you over the age of 60 and getting up a few times at night to go pee? Maybe you're even up 4 or 5 times, or maybe even more than that. How much sleep are you getting at night? Do you feel tired during the day? Do you have issues with focus, concentration and memory? Or maybe you're still having issues with erections and ejaculation? Well, your nighttime habits could be the reason why. And the surprising truth is, you can turn back your biological clock to heal your prostate, improve your energy, focus, and even fix your sleep. So keep watching, because today I'm going to show you how. I'm an anti-aging urologist and pelvic surgeon, and I make new content on bladder health, sexual health, and much more every Monday and Friday. If you like what you see, make sure you share this channel with your friends so we can educate them too. Now, let's get started. Okay, so what exactly is the connection between our daily habits and our prostate health? Well, first, let's talk about what happens when you develop prostate enlargement. The urethra is the pee tube that carries urine from the bladder to the outside of the body. When the prostate enlarges, it pushes on the urethra, kind of like a bicycle chain pushing on a bike spoke. It can make it harder to empty the bladder completely, which leads to incomplete emptying and therefore can lead to dribble. And when the bladder is trying to squeeze out all the urine but can't, it actually gets weaker over time, so it can lead to hesitancy and straining to urinate. And lastly, the increased pressure in the bladder, because it can't empty well, then compresses certain nerves, called the sacral nerves, which are also connected to your sexual function. So this can cause issues with ejaculation, direction of the ejaculate, and even erectile dysfunction. So let's talk about the 7 nighttime habits that can slowly destroy your prostate after 60. Number 1 is drinking fluids right before bed. Fluids that you drink at nighttime end up being stored in your bladder, and the problem is when you go to bed, gravity makes the fluid pool in your lower part of your body, so it ends up filling up your bladder. When you lay down, your body still thinks it has to fill your bladder, so it sends signals to your brain that it's time to go to the bathroom. This is especially true when you drink caffeine or alcohol, which irritates the bladder and makes you more likely to want to urinate. Also, when you're sleeping, you're not able to get up and urinate, right? So the fluid just keeps pooling in your bladder, and it continues to stretch the bladder muscles. Over time, this chronic stretching of the bladder actually causes the bladder muscles to relax, making it even harder to urinate completely and leading to incomplete emptying, which we talked about earlier. Now, the next habit is waking up in the middle of the night for any reason. So maybe you had a dream, maybe you need to use the restroom, but then going back to sleep becomes difficult. When this happens, you produce more stress hormones like cortisol, which raise your blood pressure and your heart rate. This state of high alert actually prevents your body from producing chemicals that promote sleep, making it harder to fall back asleep. The problem is that not sleeping enough disrupts the balance of hormones in your body and lowers your testosterone levels. Testosterone is the hormone that helps your body maintain a normal size prostate. So when your testosterone levels drop, your risk for prostate enlargement goes higher. So basically, not sleeping well can directly affect the growth of your prostate. Number 3 is waiting too long to urinate. So some people might say, well, I don't wait too long. I go when I have to go. But when you hold your urine for prolonged periods of time, it ends up creating a high-pressure situation inside your bladder. Think about it like when you blow air into a balloon. What happens? It expands. Well, when you hold your urine, the bladder expands and stretches. Over time, this chronic expansion of the bladder weakens the muscles in the bladder wall and increases the risk of leakage. Incontinence is not something you want to deal with, and delaying urination can put you at higher risk for that. The next thing is underestimating the importance of sleep. Now, sleep is essential for overall health. It helps repair tissues, build muscle, and restore energy. It also promotes healthy blood pressure, which is needed to help keep your prostate healthy. Not getting enough sleep alters hormone levels, like we mentioned earlier, and increases stress hormones like cortisol. And again, we know that stress hormones are bad for prostate health, so if you're not getting enough sleep, you're probably not healing well, your testosterone's probably low, and your prostate is suffering because of it. Number 5 is eating dinner too close to bedtime. Eating dinner too close to bedtime can disrupt sleep quality because digestion requires a lot of blood flow to move food through your digestive tract. When you eat a heavy meal, your body will divert blood flow to the stomach and intestines to aid in digestion. This can lead to discomfort, acid reflux, and bloating, which can make falling asleep more difficult. And once again, when you don't sleep well, you increase those stress hormones, which we know are not good for your prostate. Next is drinking alcohol before bed. So alcohol can make you feel relaxed, but it's a diuretic, meaning it makes you urinate more. This means that you're going to wake up more often to urinate, which once again puts that increased pressure on your prostate and prevents you from getting a restful sleep. Alcohol can also disrupt the neurologic connections between your brain and your bladder, leading to urgency, frequency, and even incontinence. And it also can prevent you from getting quality sleep, just like we talked about before. And last but certainly not least, not staying active during the day. Exercise is important for overall health and can help improve sleep quality. Exercise releases endorphins, which have mood-boosting effects. And this is important because a positive mood helps you sleep better. Exercise also helps you relax and reduces tension. Just make sure you're not exercising too close to bedtime. You want to try to finish your exercise at least 3 hours before you plan on going to bed. So let me ask you a question. How many of these things are you currently doing? Comment down below if you're doing 1, 2, or all 7 of these things. Because the truth is, we all suffer from one or more of these things. But now that you know better, you can do better, right? And fixing your nighttime habits is key to improving your prostate health. Let me tell you how. First, cut out fluids right before bed. Try to avoid drinking any fluids, especially caffeinated or alcoholic beverages, at least 2 hours before bedtime. And I would recommend setting an alarm on your phone to remind yourself to stop drinking fluids. So this gives your body enough time to empty the bladder before you go to sleep. And while you're sleeping, gravity pulls the fluid back down to your lower extremities and prevents fluid from building up in your bladder. Next, establish a regular sleep schedule. Go to bed and wake up at the same time every day. This helps regulate your body's natural sleep-wake cycle, improving sleep quality and promoting better prostate health. Number 3. Make sure you're getting up at least 2 times a night to urinate. Waking up twice a night is normal for men over the age of 60. If you're only getting up once, you may be holding it too much during the day, and this could be contributing to your urinary symptoms, so make sure you're getting up at least twice a night. The next thing is cut out late-night snacks. Avoid eating heavy meals within 3 hours of bedtime, and instead have your last meal earlier in the evening to allow your body sufficient time to digest before sleep. Number 5 is monitor alcohol consumption. Limit or eliminate alcohol intake, especially before bed. And I know this is easier said than done. But try to be mindful of your alcohol consumption and its impact on your sleep and urinary symptoms. Next, incorporate regular exercise into your daily routine. Aim for at least 30 minutes of moderate intensity exercise most days of the week, but again, not too close to bedtime. Regular exercise can significantly improve sleep quality and support overall prostate health. Last but not least, make sure you invest in a physical alarm clock. So if you're waking up naturally without an alarm, that's great. But sometimes we need a little help, right? And investing in a physical alarm clock can help you wake up gently and avoid startling awake, which can disrupt sleep quality. Guys, remember, your prostate health is in your hands. By making simple changes to your nighttime habits, you can make a world of difference. Start with small, achievable goals and gradually build from there. Each step you take brings you closer to a healthier, happier you. If you like this video, make sure you check out my last video on foods that shrink your prostate. And also make sure you subscribe so you get automatically notified when I post new content. And always, remember to take care of yourself because you're worth it.